how to revise anesthesia in one day. All these short subjects are easy to score. Anesthesia, ENT, right, psychiatry, radiology. You will see all of them. The number of questions that come are normally between 4 to 8. So do you see a difference of 20 questions gives you a jump of 11,000 rank. Target around 200 to 300 MCQs per day. 2 questions will be coming from here, another 2 questions will be coming from here, and this is how you plan for studying or revising anesthesia in one day before your exam. We are also coming up with the NEET PG Marathon. Hello guys, my name is Dr. Vinish and I am the faculty in anesthesia with PW Medit team. Today, I'll be discussing a very important topic in anesthesia where I'll be sharing with you how to revise anesthesia in one day. Yes, how to revise anesthesia in one day. I got a lot of queries from students asking me as to how much time minimum is needed if I just want to revise anesthesia. So I just made up a plan where you can study anesthesia and revise anesthesia in one day. And of course, you have to have read before, right? So this is a plan. It's a revision plan basically for anesthesia, right? It's a revision plan for anesthesia. First of all, why is anesthesia important for this exam success? This is for NEET PG and FMG students, even for ANAESTHESIA. It's valid for ANAESTHESIA students as well. So why is anesthesia important for exam success? Remember guys, this subject, anesthesia, in fact, all the short subjects give you a good scoring opportunity. All these short subjects are easy to score. The effort that you put in versus the amount of result that you might get, that is more with these short subjects. It's not just about anesthesia. You must have heard everyone talk about skin, about radiology, about, psychiatry, as well as opthal and ENT, all the subjects, all these subjects, they play a very important role. I'm not saying the major subjects are not important, but the short subjects are equally important, right? Apart from the scoring opportunity that they present in exam, the clinical relevance of all these subjects, especially anesthesia, is very important because the knowledge of anesthesia helps to understand the perioperative care of the patient, also helps in patient safety, and thereby it also helps with the integrated learning. The knowledge of anesthesia is basically the concepts that we have. They always overlap with medicine, surgery, and pharmacology. So those concepts become much more clear, and it's an integrated thing that anesthesia is all about. Before I go to discuss the plan, I would like to discuss about the number of questions that I was talking about, and I've shared this before as well. So if you will see last year's questions that were asked in NEET PG, remember last year it was held in 2 shifts, right? So if you will see the short subjects, which is, as I was saying, between anesthesia, ENT, right, psychiatry, radiology, you will see all of them. The number of questions that come are normally between 4 to 8. Let's take only 4 subjects that I'm talking about: anesthesia, skin or dermatology, psychiatry, and radiology. So these 4 subjects, if you can see, have almost 5 to 6 questions each coming in. So let me take, even if there are these 4 subjects and you have got 6 questions coming from each of them, let's take, so you almost get around 32 questions coming from just these 4 subjects. The short ones I'm talking about, which is your skin, anesthesia, radiology, and psychiatry. You are getting almost 32 questions coming from here, right? All these minor subjects are important, including anesthesia. Remember, these are the subjects which help you to secure a good score and finally a good rank. This is your last year's, someone who got a number of questions of 145 correct. I've discussed this before as well. 145 questions correct gave a rank of about 12K. But if you could make 10 more questions correct, which is around 155 questions were right, in this case, the rank jumped up by almost 6,000 ranks to 6,500. If you made further 10 questions correct, right, so which is 165 questions now, the rank is 900. So do you see a difference of 20 questions gives you a jump of 11,000 rank, which is major. So right, it's not about just scoring well in one subject, 2 subjects, about all the subjects. But finally, what matters are these 10-15 questions or these 20 questions which give you a jump of almost 11,000. So remember, every mark counts when you're looking out for the rank, and every mark counts while aiming for the top rank, right? Keeping this in mind, I just wanted to let you know that all these minor subjects are also very important. Don't neglect them, but yes, don't waste too much time also on them. And hence we have a plan right now. What's the plan for studying anesthesia in one day? Basically, what's the plan to revise anesthesia in one day? Let me put it more appropriately. How should we revise? Right, my point is about the revision. What is the plan for revision of anesthesia in one day? How much time should I give? Right? All the students have asked me this. So let me go forward. How much time should we give minimum in that one day for anesthesia? 12 hours. 12 hours is what is needed. And in those 12 hours, what are we going to do? So the plan that we are discussing, it's going to focus upon the high yield topics. So what are the high yield topics from anesthesia where questions are normally expected? Always questions are coming from pharmac of anesthesia, whether it's muscle relaxants, inhalational or IV drugs. Equipment part of anesthesia. All of you know always there's a question of the oropharyngeal, nasopharyngeal airways or laryngeal mask airway or endotracheal tube, laryngoscope. All these questions of anesthesia, vein circuit or any type of circuit, anesthesia machine cylinders, you get all these questions coming from there. Various techniques like spinal epidural, you're always going to get some question based on that, and that may be related to anatomy also. I told about integrated learning, there can be questions from anatomy here as well. Miscellaneous topics important from anesthesia are things, subjects like or points like CPR, ventilators, modes of ventilation, they are very important, and conceptual topics. Conceptual topics means where you have those concepts coming in mind, especially related to pharmac or when you have got difficult airway algorithms. So all those concepts which will become important. So these are the high yield topics from anesthesia, and the conceptual topics are also put up in one more way. Apart from having being the conceptual topic, it is also basically integrated ones, the ones which are integrated with other branches. You know, when you find when we do a when the exams are over and then we discuss all the questions out, right? So when we are discussing, you will find that, you know, a same question has been discussed in medicine, same by anesthesia, same by surgery, same by anesthesia. The maximum number of integrated questions which overlap with other branches is anesthesia. So let's take this one more point as conceptual topics or integrated questions which come with other branches. So this is the point where I'm going to, these are the topics that we need to focus upon, right? These are the topics on which we are focused upon, right? Our focus has to be here. But more than that, another important thing is about the revision that we are doing. So no doubt these high yield topics, our focus is there and we are going to read about them. But what's the point of reading if you don't solve MCQs and you don't know where you stand? So therefore an effective revision is incomplete without solving MCQs. So whatever 12 hours are we going to have, in that case we have to discuss the MCQs. But once you have discussed the MCQ, once you solve the MCQs, right, that is going to complete your revision. But when you solve the MCQs, we are supposed to analyze them also. We are supposed to analyze where were the mistakes, where did we get confused. So therefore, apart from solving the MCQs, the analysis of the MCQs also becomes important. So now I'm discussing the plan as to how we divide those 12 hours, right? So what's the plan for studying the anesthesia in one day? How do we divide these 12 hours into the topics that we've thought about, the high yield topics, the effective revision for MCQs, and for the analysis, right? So what's our plan of dividing these 12 hours? So remember, we need to have 12 hours of focused study. 12 hours is what I need, right, for completing anesthesia in one day. Early morning when you get up, a lot of you might be liking to read immediately, and I know a lot of you are early birds, might get up in the morning, but most of us, if you ask me also, getting up in the morning and opening a book just to revise is very difficult for me. I wouldn't be able to do it. So I've thought about that type and and put up the division in such a way that early morning you don't start reading immediately, you first solve an MCQ. For that we've given about an hour and a half. This is my favorite part when the revision. I always have said that whenever students have asked me, or even for myself, I've always went in this manner or this fashion itself, where the early morning part we have given our hour and a half for MCQs, right? This hour and a half have gone for MCQs. This is the morning time. After that, the next block is a block of 9 hours. These 9 hours that we are getting, this is the time to study, this is the time to read, and this is the time to revise whatever we have read till now. Remember, no reading anything new, and focus on the same source of information that you have. Don't change your source of information, right? Stick to that one source. The first thing, stick to that one source that you have been studying for. No added information, okay? No new points to be studied. Don't do it unnecessary. You might not recollect or remember them. You just need to revise what has been done, right? So these are 2 points when you're doing the revision. Stick to the source that you've been following and don't add new points or new things to study now, right? We're not supposed to do that. These are 9 hours now. After the 9 hours, another 1.5 hours before you go off to sleep. This is the night time. So morning, afternoon, evening combination was, these 9 hours. And after that, at night, again, we have given some time for MCQs. so that you can solve the MCQs at night. Now, the point is how many MCQs to solve. Always, whenever students have asked me, again, I've always said the same thing. You should always try to target, that's my way of thinking, target around 200 to 300 MCQs per day. I used to say the same thing for FMG students as well. That is, a lot of teachers might think differently. That is my way of thinking. Many times I do understand if you targeting 200, 300 is difficult. I agree. So therefore, you keep a target of 200 to 300, but ultimately I feel at the end, people settle down, students settle down for between 100 to 100 per day. And remember, this is doable. 300, I agree, many times it's not doable, but 100 to 100 MCQs per day is doable. This is what is going to help you for revision. So now what you can do is, let's target not 100, not 300. Let's target that we will be doing around 200 MCQs, right? 200 questions from anesthesia. We will split them into two. We are going to do 100 questions in the morning, right? So you do 100 questions, 75 to 100 again, you can do that, right? So you can make it 75 to 100 questions. This I do within a time of 1 hour. And after that, I keep 30 minutes to analyze what were the mistakes. Where did I go wrong? What is the point that I did not remember? So 30 minutes for analysis of those questions. The same thing will repeat at night. At night as well, you will be doing 100 questions, do it within 1 hour, and then analyze them in 30 minutes. The analysis becomes a very important part. It plays a very important role. It's no point if you don't analyze where are the mistakes, where did you get confused. This is the most important part of solving an MCQ. No doubt the MCQ was important, but to analyze that is even more important. Now, how do you plan the time that you've kept for studying? How do we plan these 9 hours, right? So remember, we have to complete whole of anesthesia in these 9 hours. We're supposed to read complete anesthesia in these 9 hours. How do we plan for this? So this we will divide into blocks of 3 hours each. 3 hours, 3 hours, and 3 hours, right? So we'll divide them into blocks of 3 hours each, right? So what's the overall plan, how to revise those 9 hours? So I'm now discussing about those 9 hours, the block of 9 hours that we made into 3 hours each. So what we have done is the initial 3 hours. Let's try to discuss or study the basics of anesthesia. The next 3 hours, we will go into the clinical part of anesthesia. And the last 3 hours, we have kept for miscellaneous and emergencies and other parts of anesthesia which are important. If someone will ask me, I will say, yes, it's not exactly that you stick to 3 hours. You can change it depending as to what topics are strong and what topics need more focus according to you. Basics of anesthesia, you might finish within 2 to 2.5 hours also, possibly. Clinical anesthesia, I feel, might even take 3 to 4.5 hours. So you can change it slightly here. And miscellaneous and emergencies, according to me, again can be done within an hour and a half to 2 hours. Okay, within an hour and a half to 2 hours. All right. So depending as to how well you're prepared with various parts of anesthesia, this is how we have divided. But yes, in general, the blocks are basically 3 hours each. So basics of anesthesia, remember what are the things that you need to cover. So in the basics of anesthesia, the pre-operative evaluation forms an important part. Recently, a lot of questions have come regarding ASA grading, Malam Patti classification. These are your previous year's topics. Focus on them. Also, the drugs that need to be stopped before surgery, right? What are the medications to be stopped before surgery? That also plays a very important role. So this is an important point. ASA grading, Malam Patti classification, the airway examination, medications before surgery. Talking about anesthesia equipment, the basic anesthesia equipment that they ask questions about are from the anesthesia machine, breathing circuits. Very important. So from the anesthesia machine, you are all aware that you're supposed to be talking or knowing about cylinders. You're supposed to be knowing about the pin index numbers, the color, right? You're supposed to know about the pipelines. You're supposed to know about the vaporizer. All these are important points, right? Even the pipelines. All these are important, right? Vaporizer, pipelines, all these are important questions that come. Breathing circuits. Now, when you speak about breathing circuits, so even the Mapleson circuits are important as well as the closed circuit. So when you speak of Mapleson circuit, I will say, for exam purposes for revision now, only A, D, and F are the most important. And of course, circle system needs to be studied as well. So these are the circuits that you need to know. So anesthesia machine and breathing circuits are the part of anesthesia equipment that you need to know. Going further, anesthesia equipment would also involve the things that we use, the devices that we use for airway management. So for airway management, all the devices are important, whether it is the endotracheal tube, it's the laryngoscope, the various types of endotracheal tube. All of you know, many times the question comes regarding the confirmation of the position of endotracheal tube or the types. Even LMA, laryngeal mask airway, recent questions have been there. Last year NEET PG, you had questions about the nasopharyngeal airway. So remember nasopharyngeal airway, oropharyngeal airway, bag mask ventilation. In fact, if you remember, there was a question on PEEP valve, right? Ambu bag. So all that questions become important, that airway management becomes very important. So these are all the instruments, even Ambu. Remember that's a last year question itself, that Ambu bag question which came. So airway management, all the devices which are there, you just have to go through that. And remember, in these two, the images are very important, right? The images are very important here. Similarly, for monitoring, bispectral index, capnography, and neuromuscular monitor. Here too, the images become very important, especially the capnography graph. So bispectral index, capnography, neuromuscular monitor, you can just go through them, breeze through them. You don't have to study too much in detail, but the images are important. You just have to see that. So these are the basics of anesthesia. According to me, you can finish off this within 2.5 hours. If you have well read before, you can just revise them in 2.5 hours. And yes, you can take 3 hours also. But the next part, which is clinical anesthesia, this needs more focus. As I was saying, you know, from all these parts, remember, definitely one question comes from anesthesia. You pick up any paper. Remember, from the basics of anesthesia, definitely one question will come. All of you know some question has always been asked about a breathing circuit or endotracheal tube or LMA. Last year I discussed 2 questions only from here. So one question is always going to come from this part. One question or 2 questions are always going to come from clinical anesthesia. You know, one question about the drugs is always there, and one question from spinal epidural is also there, right? So about 1 to 2 questions from here, 1 to 2 questions from here are always going to be there, guys, right? So these are the important points. General anesthesia. Let's discuss about what are the points important where we need to focus upon in general anesthesia. So general anesthesia, the anesthesia drugs are important, right? The conduct of anesthesia is also important. And in terms of conduct of general anesthesia, I mean, of course, in that case, endotracheal tube and laryngoscope, all those things come into play, right? So you're supposed to know that. Okay. Apart from that, what drugs are you going to use? So inhalational induction agents, IV induction agents, and muscle laxants form the basic. Apart from that, opioids and benzodiazepines were important, but this gets covered very well in pharmac. Okay. So this is a topic which normally is absolutely covered very well in pharmac. So if you're not studying from the anesthesia point of view, remember that pharmac is going to cover it up. Okay. But inhalationals, IV and muscle laxants, whichever source you have, you should study from the anesthesia notes which you have. Then discussing about local anesthetics. Again, questions come regarding local anesthesia as well as regional. So in regional anesthesia, spinal epidural are the most important. Yes, we have studied blocks also, and we do study that. But from exam point of view, the most important are spinal and epidural. So you can always expect one question coming from here, one question coming from here. So 2 questions are here. One question coming from here and one question kind of coming from here. So 4 questions go there, right? And the next 2 questions that might come are from these topics. That makes 6 questions, right? That's what you were saying. We would be getting around 4 to 6 questions, and that's what we've targeted. The next 2 questions are going to be either the difficult airway algorithm or the oxygen delivery devices. So you're supposed to know these algorithms which are there. Okay. Then after that, oxygen delivery devices, all of you are aware that whether it is the low flow devices or the high flow devices, always normally a question comes from this part as well, whether it is regarding venturi mask, high flow nasal cannula, or it is regarding a simple face mask, non-rebreathing mask, nasal prongs, or the nasal cannula, right? So this is what you need to know. And here also remember, image-based questions are important, right? Oxygen delivery devices, the image-based questions are important here also. So you have to go through the images here. Acha, even in spinal and epidural, here also images are important, the anatomy part. So here also the images are important. Okay. So when you're studying spinal epidural, you have to go through the image also. Oxygen delivery devices, again, you have to go through the image, right? So you discuss the high flow, low flow. Continuing beyond, nowadays some questions are always asked about modes of ventilation, and that is not necessarily part of anesthesia. It may be integrated with medicine or pediatrics also. So for example, they might give you a patient on ventilator and they might ask you about ABG values. So that those questions also come. But simple questions recently, in fact, in FMG exam, regularly, repeatedly, they've given 2 times questions regarding BiPAP, continuously 2 times. So that non-invasive and invasive ventilation both are important. So remember, you just have to go through this. I will not say study too much, but just overhead, you should be knowing about the non-invasive ventilation, which is CPAP and BiPAP, and the invasive ventilation, especially the lung protective strategy. Nowadays, a very important question regarding lung protective strategy comes, and that lung protective strategy, which is low tidal volume and high PEEP. So this question, especially for that ARDS, this point is very important regarding the low tidal volume and high PEEP. So this question is very important, which comes in the exam. It may be asked. So remember that. So non-invasive and invasive ventilation also a part of miscellaneous. And not to forget, in one way or the other, there's definitely going to be a question on CPR. One way or the other, not necessarily from anesthesia. It may be from pediatrics. It may be from medicine, orthopedics, surgery, casualty, trauma, any emergency patient coming and you have to manage the airway, or what is to be done for a patient who has just collapsed. The point is, you are going to get a question on CPR or a question on emergency management of a patient, which can be from any branch which is integrated. So as you can see, 2 marks, 2 questions normally would be coming from here, but 2 questions will be coming from here, another 2 questions will be coming from here. Normally this is going to be your 4 to 6 questions which are asked in the exam. That is my take on it. And if you have studied this part, this takes care of the complete revision. As I said, the clinical anesthesia part is what I feel might need a little bit more time compared to this miscellaneous and emergencies, because these are basically short topics. You can just turn them and they'll be integrated with other branches also. So revision takes place there as well. So this was the overall study plan. So now you can see that whatever we have discussed, this is how we are studying. The 12 hours that we put in on that one day that we are studying anesthesia, the initial 1.5 in the morning, 1.5 hour in the morning, that went for our MCQ solving and analysis of that. The other 9 hours of the day was to revise the complete topics that we had. We went through that, we saw the images, and before going off to sleep at night, we again solved the MCQs and analyzed the answers. And this is how you plan for studying or revising anesthesia in one day before your exam. It holds true for NEET PG and yes, even for FMG students. Right now, from our PW Med, we have already started our PYQ series. Already 3-4 these subjects have already been done, and remaining subjects are still remaining. A lot of you have joined us also, but this is just to remind you that PYQ series are already going on from PW Med. You guys can join us. It is there at YouTube, and we normally conduct it at 6 p.m. Right? So here's the schedule that I'm sharing with you guys, and you can join us on YouTube for the PYQ discussion which is there. All right. Apart from that, we are also coming up with the NEET PG marathon. A little bit we had taken before also, but we are going to come up with this NEET PG marathon. This is going to go on for the whole day, and stay connected with us, and we'll just let you know how the days are planned and how the timings are planned. Right? If there are any other questions that you have, guys, you can direct it to me, direct to PW team. Right? I'm sharing my Instagram ID with you. You can connect to me with on Insta. I'm sharing my Instagram ID. It's drshort.vinish. So you can connect with me over there. Any questions, any doubts, any queries, feel free to ask me. I'll try to answer them to the best of my knowledge. Thank you guys for joining me at this session. All the best. Do well.